I'm Dr. Couri. For those of you who do not know who I am, I've been in private practice here in this location for about 14 years. I went to medical, I'm a lifelong Peoria native, went to medical school here in Peoria, and then did my residency in OBGYN at St. Francis, and then started private practice. And I was in private practice for about 10 years when I realized that the tools in my toolbox weren't exactly adequate enough for me to be able to take care of all of the new problems that were coming through my door. And I love and I'm very grateful for my traditional Western medicine training. I think traditional Western medicine does a great job at treating acute problems. If you're having a heart attack, if you're having a stroke, if you've got a rip-roaring infection, you definitely want to be in a traditional Western medical facility. But if you have chronic disease, if you have diabetes, if you have heart disease, if you have hypertension, you have Alzheimer's, we are only as good as the tools that we have to treat these diseases, and unfortunately, we don't have the best tools for disease management because even though there may be a pill for every ill in traditional Western medicine, those pills, as you'll see on my slides, don't always work. So I needed more tools, and so I then did some soul searching to figure out where I wanted to get them. I've always been very intrigued by some of the ancient healing traditions of other cultures, like Ayurveda and traditional Chinese medicine. And so I sought out the help of Dr. Andrew Weil at the University of Arizona and did a 2-year fellowship with him in that program, and felt like he helped add more tools to my toolbox. And then at that point, I was better, but I still wasn't quite where I wanted to be. I needed more help with nutrition. And I then did another 2-year fellowship in metabolic and nutritional and functional medicine. So now I think I've got the tools that I need. And I am very anxious to share those with you. And I'll explain to you how our practice is a little different than maybe your primary care doctor's office. So I'm blessed to have an amazing team that work with me. My nurse, Teresa, who has been with me since day one, 14 years ago, still puts up with me. Sue Lang, who is one of our advanced practice nurses, and Hope Plaker, who's also going to speak tonight, is our PA. Leslie Rushbear is our licensed or registered dietitian and exercise physiologist. And Terry Planin is another advanced practice nurse. She is not here tonight. So I've surrounded myself with a team of like-minded individuals so that we can deliver what we call personalized medicine to you all. And I'll talk to you as we get into the slides about what personalized medicine is, because in order to really tackle the very complex chronic medical problems that we as Americans face, it can't be done in a 10-minute office visit. It can't be done with your doctor's hand on the doorknob wanting to leave the room because you have a list of, your very pertinent questions that you want answered. And I was that doctor at one time. I'm sure I was, whether I admit it or not, just because that's the way the Western medical model works, and that's what they reward you for, is more patients in, more patients out, more patients in, more revenue. So that model in my mind wasn't working, and it still doesn't work. So I needed a team to be able to help me, and that's why I've surrounded myself with such amazingly talented people who all share my same vision and same mission. So we're going to talk a little bit tonight about personalizing your healthcare experience. I'm going to start out, and then Leslie is going to speak, and Hope's going to wrap it up. So I had the wonderful opportunity a few weekends ago in San Diego to listen to Dr. Jeffrey Bland, who is the father of functional medicine. I don't know if anyone has heard about the new functional medicine clinic at the Cleveland Clinic, but there's a new clinic that the Cleveland Clinic has started that does just this, personalized medicine, and you're going to hear more and more about it. But Dr. Bland says, throughout your life, the most profound influences on your health, vitality, and function are not the doctors you have visited, surgery, or other therapies you have undertaken. The most profound influences are the cumulative effects of the decisions you make about your diet and lifestyle on the expression of your genes. And we'll expand on that in a little bit. And I truly believe that because your cells respond to how you eat, move, act, breathe, excrete, and think. There's power and potential in everyday choices. So the food that you eat, the thoughts that you think, how much you move, how much stress you're under, all of that is playing a very critical role in whether we're healthy or whether we're not healthy. And I just pose this question, if your healthcare providers are not asking you, how do you eat? How is your stress level? How much exercise are you getting? What are your support systems? When was the last time you felt well? Tell me about where you live. Do you live near power plants where you may be exposed to some very, very harmful chemicals? How does your doctor truly know who you are? How do we know what your story is? Every patient has a different story. And we like to hear your story because that's how we know who you are. And that's the heart of personalized medicine. So did you know that almost half of adult Americans, 133 million, suffer from at least one chronic illness? And I think most of us in the room probably are aware that there's a lot of chronic illness, especially in this country, but it's becoming a global problem. We're not the only country by any means. Among Medicare patients, more than half are being treated for multiple chronic conditions. And the CDC estimates that managing chronic illnesses accounts for 78, almost 80% of our nation's healthcare expenditures. And the sad thing is that 75% of healthcare costs, so 3/4 of every dollar that we spend on healthcare costs, are spent on absolutely 100% preventable diseases. Preventable, meaning they don't have to happen. And so to me, those numbers are staggering. And that is true healthcare reform, in my opinion. That is what healthcare reform is and should be, bringing health back to healthcare reform. But it's going to take a team. So what are the diseases that are induced by your lifestyle? Well, I think we all are aware. Heart disease and stroke, number 1 and 2 killers of Americans. Diabetes, obesity, metabolic syndrome, which just means when you have high insulin levels and your blood sugars aren't all that well controlled and your cholesterol patterns may be a little bit off. Lung disease and some form of cancers, all induced by lifestyle. So again, all can be preventable. These slides I know are a little bit busy, these maps, but I don't know if anyone's ever seen these maps. These are the maps off of the CDC website, and they're maps of obesity. And in 1985, that's up here in the left-hand corner, the white states are the ones that weren't even keeping any data on obesity. It wasn't that big of a deal. It wasn't necessarily something that we felt was a major threat to our health at that time. Some of the other states started keeping data on it, but as a whole, there was no state in 1985 that reported more than 14% obesity among its constituents. No state. In 1995, so we're going to jump ahead 10 years, in 1995, now they all are keeping statistics because it's becoming much more of a problem. So half of the country has about 10 to 14% obesity rates, and the other half now has a new category. Up to 19% of its populace are obese. Jump ahead 10 more years to 2005, we now have a lot more new categories. This bright orange is 25 to 29% obesity, and then this darker orange is greater than 30% in just 10 years. And then 5 years later, we've lost Colorado. It no longer is among the 19% or less obesity rates. Most of the southern states are showing greater than 30% obesity. So this is what we see day in and day out as healthcare providers, and this is taking its toll on our healthcare system. And we need to reverse this. This is 2013. So there's some new colors, but we now have a new category as well, greater than 35% obesity. And you can see that now almost half of the country is a third obese. So I just show that because it's staggering to me when I looked at the trend. But it is the harsh reality, and I think it's multifactorial. So this slide, I know you can't read it, but this talking about polypharmacy, or the concept of people having to take multiple medications. So this older gentleman is saying, well, the Glaxo pill protects my heart from the side effects of the Pfizer pill that prevents potential liver failure due to the Merck pill that minimizes the risk of stroke posed by the Novartis pill that reduces blood clots caused by the Glaxo pill. And he says, the devil of it is I can't remember the illness that started all this. So, I mean, we laugh, and I laughed when I read it, and but unfortunately, it's so true. You know, you get a pill for your heartburn, and then you get a pill for your osteoporosis because your pill for your heartburn gave you osteoporosis. And then your pill for your osteoporosis causes your jaw to necrose, so then you get a pill for your dental health, and the list is endless. And unless, you know, unfortunately, as a physician, I think sometimes we spend a lot of time mopping up the water on the floor, but we have to look upstream and we have to turn off the faucet. We got to turn off the faucet, and that's, again, where we're trying to hit home this idea of personalized medicine, lifestyle medicine. So one size does not fit all by any means. You are all different. You all come with a different story and a whole different set of genes and a whole different set of risk factors for certain diseases. So we can't treat you all the same. So drug effectiveness in managing key chronic illnesses. So when you look at drugs for Alzheimer's disease, they are 30% effective. That is it, 30%. Heart disease, we have about 60% effectiveness. And at the last conference I was at, the world-renowned cardiologist from Vanderbilt said, we have reached the limit of the effectiveness that we're going to have on heart disease right now. It is it. This is it. So if we don't make major lifestyle changes and lifestyle education, we are not going to have any greater impact on curing the #1 killer of Americans. Antidepressants are about 62% effective in treating that disease. 57% effectiveness in treating diabetes with pills. About half of the pills for migraines are effective, and unfortunately, only a third of cancer treatments are effective. So the power of lifestyle medicine cannot be emphasized enough, because we can have a much greater impact on that. But there's a new idea, a very, very, very exciting new idea that it's definitely going to change the health of the world. And I can't wait. It's called personalized medicine, or health is personal. So your genetic code, your genes, hold the future for those of us healthcare providers to be able to take care of you in a much more personal way. And if you haven't read the article, in the newsletter this month, I wrote an article about the personalized way to treat cardiovascular disease. It's on or heart disease. So it's the lead article on the front page. So if you say, well, you know what, I don't really want to know my genes, because if I knew my genes, I don't know if I'd want to know that I'm at a higher risk of Alzheimer's, or I don't know if I want to know if I'm at a higher risk of breast cancer or heart disease. But what I'm going to tell you is, even though your genes are inherited, it's not inevitable that you're going to develop those diseases, okay? So when you look at the statistics, 30% of chronic disease is strongly genetically linked, all right? But the flip side of that is 70% of chronic disease is strongly linked to lifestyle and nutrition and environment. So all of that information, what we eat, what we drink, what we breathe, the air that we breathe, the thoughts that we think, are we grateful? Do we practice gratitude? Do we eliminate toxins? All of that information talks to our genes, okay? It's information that turns our genes on or turns our genes off. And the beautiful thing about it is, what I also learned at my conferences, There are now tests to see if those genes that may put you at a higher risk of heart disease are turned on or not. And if they are turned on, if you start these lifestyle programs to turn them off, you can then retest to see if those lifestyle changes are helping. So that's why I'm so excited, because we all know it's right to eat healthy and get enough sleep and exercise. But how do you really know if it's working? You know, I mean, how do you really know? You might feel better, your pants may fit better, your labs may look a little better on paper, but is it affecting your genetic materials? Is it affecting your DNA? And now we know, because there are tests that will tell us if everything that you're doing is working. And that's really exciting. You probably, if anybody watched the State of the Union, you probably heard Obama talking about personalized medicine. It's been in multiple newspapers as the headlines. Hospitals, doctors cheer Obama's call for personalized medicine. Obama prioritizes personalized medicine. So this is 21st century medicine. This is where it's going. And I'm so excited to be a part of it. Just one more example of telling you or showing you that your DNA is not your destiny. I'll read this to you because I know you probably can't read it in the back. So has everybody heard of the BRCA gene, the breast cancer gene? All right, so I want you to think about this. If you, the lifetime risk of developing breast cancer, if you have that BRCA gene mutation, in 2015, if you have that BRCA gene mutation, your lifetime risk of developing breast cancer is 82%, pretty high. But if you had that BRCA gene mutation and you lived before 1940, the risk of developing breast cancer was only 24%, okay? So what changed? What changed? You know, was it the gene? No, genes can't change in 60 some years. So everything around us changed. Our diet changed, pesticides, GMOs, the health of the soil, the air that we breathe changed. Maybe our stress levels changed. Maybe all that electromagnetic radiation that we're getting from iPhone, iPad, you name it. You know, all that stuff changed. That's what's talking to our DNA, right? That's what's changing our risk for disease. So I just bring that up to show you that all those lifestyle factors are very powerful. So food is information for our genes. Can't state it enough. I lectured the medical students today on nutrition, and we spent a whole hour talking about that. So the bottom line I want you to take home, genetic inheritance is not your fate, okay? You have the opportunity and the power to shape your own pattern of health and longevity, and that's really important. You are powerful, and I, as a physician, love to empower patients to help them realize that how much control they have over their own destiny. And this is what personalized health management is all about. So what we did here to try to bring this to the masses is we created a lifestyle program that revolves around personalized medicine, because you can't get this type of medicine in one office visit. It takes a number of weeks to teach all of these things. So that's our TLC program. Leslie's going to go into the depths of the TLC program. But how do we know how to help you reverse disease if everyone is different? So it can't be one size fits all. So we have to listen to the notes that you're playing, so to speak. If you're a piano, what notes are you playing? So what we do is we try to figure out by extensive testing what's going on within your body, so that way we can then help you optimize your health. So we get a variety of lab tests. It's not your mother's health panel. That you're not going to get, just 4 cholesterol numbers and then be told you need a statin because one of those cholesterol numbers is high. That's absolutely ludicrous. You're going to have advanced lipid testing that looks at a whole slew of biomarkers about your cholesterol. You're going to have expanded thyroid testing. We look at your hormones, because hormones, if you look at everything else and you don't pay attention to hormones, you're missing a very large portion of health. We'll look at food sensitivities. So is the food that you're eating helping to create a healthy environment within you, or is it sabotaging your health? We look at your stress, your resiliency by looking at your adrenal function. We look to see how inflamed you are, because chronic inflammation is the #1 cause of heart disease and Alzheimer's and stroke, and we also look at nutrient deficiencies. The other thing we do is some pretty extensive body composition testing. We call it BIA, where we're going to look at not only your percent body fat, but other markers to let us know what's going on a cellular level to see how we can help you with, in terms of your metabolism. We look at other markers of toxicity. We look to see if maybe heavy metals could be playing a role, because if we look at some of the standard labs and we see some things that are a little bit concerning for us in terms of heavy metals, we're going to go down that pathway, whether or not chronic infections may be playing a role, or just organic pollutants, what you've been exposed to for however many years you've walked this earth. And then we do a lot of questionnaires to see what to kind of, again, get to know you a little better with what symptoms are really bothering you. So the tools that we then have to help you, and Leslie's going to go into this in much more detail, so I'm not going to expand on it, but obviously, in my opinion, diet is absolutely critical. So we help personalize a diet for you based on your biomarker results. So it's not one size fits all. Everybody's dietary plan is different based on their food sensitivities and possibly some genetic factors that are playing a role. Lifestyle we talk about and we actually show you in our back room that we've turned into a workout facility. We really hit on exercise, sleep, stress management, environment. We talk about toxins either in your food or in your home, in your beauty products, in your healthcare products. Supplements that we may need to help get your body back on track, but those, again, are individualized to you. We still use pharmaceutical drugs. I'm a physician. I still prescribe pharmaceutical drugs if necessary, just prescribe them very judiciously. And then, again, we address hormone balance. This is one of my favorite quotes from Buddha, and if your compassion does not include yourself, it is incomplete, and I truly believe that. If you don't love yourself, if you do not invest in your own health, then how can you be healthy to everyone else around you? And I try to keep that very close. Your health is in your hands, literally, and it really is. So what you put at the end of your fork is very, very critical in determining health or the lack thereof. Stress, we all have it, especially if you're extremely busy, if you want to avoid stress, like this slide says, you were born in the wrong era. But we try to help teach you ways to mitigate that stress. We have some biofeedback programs called Heart Math that really do help with mitigating stress. Also, we teach yoga and breathing exercises. So we try to come at it in multiple different ways. And the last thing I want to just talk about is hormonal balance. Like I mentioned earlier, if hormones are not addressed, if patients are not hormonally balanced, then it's harder to achieve that goal of optimal health. So one of the things is, did you know that all of your sex hormones like estrogen and testosterone and progesterone, they're all made from cholesterol? So if you are on a statin and your doctor tells you that he wants your cholesterol down to less than 100, you don't have very much cholesterol left to make testosterone. And this is for men and women. So all these commercials about low T for men and hormone imbalance could be partly due to the fact that we are driving it down through pharmaceutical means. Not saying the statins are bad. If you need them, you need them. But just keep in mind that, again, it's all a web of interconnectedness. So you can't affect one level and not think it's going to affect other things downstream. Other things to think about with hormones is that if we are toxic, meaning if our liver is not real good at detoxification, we can have the buildup of abnormal forms of estrogen. That's for both men and women, so it's not just applicable to women. And those adverse metabolites of estrogen can increase our risk of breast cancer in women, prostate cancer in men. So how would you know if you're not detoxifying? Well, if you're constipated, if you don't sweat ever, like if you don't exercise and sweat, because we eliminate toxins through our sweat, Or if you are genetically prone to not detoxifying well, then you're again at a higher risk. Or if your gut is not healthy, if you have a very poor balance of the good and the bad bacteria in your gut, you're at a higher risk of hormonal imbalance. And that's what we test for when we do food sensitivities, because the bacteria in our gut are very helpful at a million things, but one of the things they help us with is eliminating or metabolizing our hormones. So if your gut's not healthy, your whole body's not going to be healthy. So that's another thing we look for in this program. Testosterone, men age 30 to 70 will lose 1 to 3% of total testosterone production per year, which is a little bit frightening. And then if you, again, drive your cholesterol levels too low, if you're not exercising, or if you're on other medications, that can also affect testosterone levels. Women aged 20 to 40 lose 50% of their testosterone production. And if your testosterone levels are optimal, that has a very positive impact on your cholesterol panel, how well your insulin works, or your blood sugar, so it's good for diabetics to have good testosterone levels. We build more muscle and we lose fat when our testosterone is normal or optimal. We have less bone loss, we have less osteoporosis. Our mind, our brain thinks better, we have better mental clarity, and libido improves. So that's why we spend a lot of time on hormones. So we're almost done. We don't want Band-Aids for our symptoms. We want to get to the root cause. We don't want it to be treated as a body part. We want it to be understood as a whole person. And that's kind of our mantra here. So the best project you'll ever work on is you, and I guarantee you, you will, if you do invest in you and let us help you, I think you'll be amazed at how good you can feel. Ways to stay connected with us. We have a very active Facebook and Twitter page. So usually daily, we're sending out very interesting facts, health facts, studies, little snippets of information that you might find useful, recipes. Our website, obviously, CouriCenter.com. If you don't get our monthly newsletter, sign up for it tonight. We email it to you every month, and that's where you'll find the rest ideas on, or you'll find our schedules for the rest of our classes in addition to articles and recipes. And then the wellness series classes, we're going to have 4 or 5 of classes like this over 2015. But what we want to do is want to tell you that if you miss them, we have them all video archived on our website, so you can go back and watch them. The other thing we're asking is, I know I'm going to give one talk specific in more detail on hormones, but I want to hear from you guys. You have a piece of paper there. I want to hear from you guys on topics that you would like to hear about. So if there's something that you're burning desire to learn about, let us know, and then that can be a class, because we're trying to make sure that we are meeting your needs. So don't be shy. Write on there what you think you'd like. All right, Leslie, I am going to turn it over to you, my friend. Thank you, guys.
All right. As Dr. Couri said, my name is Leslie. I am the certified personal trainer and registered dietitian on staff here. I have a bachelor's in exercise science as well as a bachelor's in dietetics. I did my internship at Iowa State University. I also did the program through the Institute of Integrative Medicine to give me a little bit more integrative look into the large world of nutrition. So again, going back to what Dr. Couri was saying, I just want to start off with a great quote by Dr. Andrew Weil. He is somebody who I know Dr. Couri started under and just leads us with some really good words of wisdom. You know, imagine a world in which medicine was oriented toward healing rather than disease, where doctors believed in the natural healing capacity of human beings and emphasized prevention above treatment. In such a world, doctors and patients would be partners working toward the same ends. So I like to start off by kind of looking at these pictures. In this day and age, they are, I think, things that we see day in and day out. They are what, unfortunately, our lifestyle has turned into. We've got fast food, we've got Homer as the, I guess, exhausted person, you know, who comes home from work nothing left in their tank, stressed out, immobile, living on high carbohydrate, sugary foods to get us going, and again, looking at a diet full of no nutrition. And then we have words like amputation, infection, prescription drugs, cancer. These are all words that come across my office every single day. They are what we have turned into. They are words that we now constantly think about. Increased premiums, I hear that all the time. Somebody's on a fixed income. You know, when they're told they have to have another prescription that costs more and more money, and yet they can't get the information of how can we decrease those prescriptions and find a way to eliminate them. And again, going back to how an unhealthy lifestyle is costing us all millions and millions of dollars, and in this case, billions. And this was in 2008. So if you add more to this, you know, heart disease and stroke, like Dr. Couri said, #1 and 2 killers of Americans right now, at that time was over $479 billion. Looking at obesity, it's kind of the cheapest one right now at a whopping $109 billion. So again, add to this 7 years of inflation and all that stuff, and you're looking at more and more money going towards something that is absolutely preventable. Quick look at, again, how things are increasing. Obesity, these are 2011, 2012 numbers. Over the age of 20, 35.1%. And then if you go over the age of 20 who are overweight, so we're adding overweight to the obesity, you're looking at 69% of Americans. That's pretty staggering. And that was 2 years ago now. Diabetes, we were at 29.1 in 2002. And of those 29.1 million people, we're looking at 21 million who were undiagnosed. 8.1 were undiagnosed. Again, staggering. Heart disease, same thing. Going back to what Dr. Couri was saying about not your mother's labs, not just wanting your HDL, your LDL, your triglycerides checked. 50 to 75% of patients hospitalized with a heart attack have normal LDL cholesterol. That's that bad cholesterol your doctor always tells you about. Is it that bad if it's normal and you're still having a heart attack? Cholesterol, again, 33.5% have high LDL, and 1 out of 3 adults with high LDL has the condition under control. So we're still looking at 2/3 of that population who have cholesterol absolutely out of control. And less than half of the adults actually get treatment. But I have this italicized because my question is, what kind of treatment are they getting? Are they getting a statin? Are they getting some form of medication? Are they being educated on how to change their lifestyle so that they don't have that problem? Alzheimer's, and again, depressive disorders, off the charts, on the rise. So again, Dr. Couri already stated this. What percentage of these diseases can be prevented? 75%. 70% of those can be affected by lifestyle changes. So that's when we created the TLC program, when we noticed this was a problem with our patients and we wanted to be able to help them. Sorry. So I'm going to show you real quick. We've got a couple just quick little videos. These are patients who have been through the TLC program that I hope their story will give you a better idea of what's going on.
The TLC program has caused me to look at the foods that I eat and figure out if it's something that I really want to eat or enjoy. It's caused me just to think about what's important in life. So, and my health is important. That's what I learned during the TLC program. It was 15 weeks long, and I was excited that I completed the TLC program without backsliding or anything like that. So I feel better, skin tone is better, and just how I interact with people, so I'm not as irritable as I was. Well, I have a new wardrobe, almost. But I think, like I said earlier, I feel better, so that's the difference. Healthy means to me not just about the food that you take in, but also exercising, and then also your stress level and how you interact with people. I think healthy is not just limited to the food that you take in. And so I think people will always worry about their health, but at the same time, I'm not worried about it like I was 15 weeks ago. I'm looking forward to losing a few more pounds. I'm looking forward to experimenting with other foods. I've learned to look at foods differently and figure out what other meals I can make. So that's what I'm looking forward to after the program. The staff here at the Couri Center is great. I enjoy my interaction with them, including when you check out at the front desk. Everyone's been very helpful and supportive and have also shared their own experiences too. I would recommend the TLC program to family and friends. I have recommended the program to friends, so yes.
So I ask you, what does optimal health look like to you? You know, I have patients come into my office every day and I ask them, what are you hoping to get out of this? Unfortunately, the number one answer I get is, you know, I want to drop 50 pounds. You know, and unfortunately, I don't think people realize that these people can also have heart disease and look like this. These people can have high cholesterol. Yes, it'd be nice, you know, to look like that and be healthy, but it's not a guarantee. You know, don't base your health on your weight. We would much rather you base your health on, are you going to be an active older adult? Or are you going to be sick and stuck at home? Are you going to have healthy relationships? Are you going to be stress-free? You know, are you going to be able to interact with your family in a healthy manner because you are healthy? Just remember, it goes beyond how much you weigh. It goes beyond what size pants you wear. Add into the rest of your life and realize that just because you lost 20 pounds doesn't mean the stress at work is going to go away. Put it all together, and that's what optimal health is, what we're shooting for anyway. Hope is going to go over who she recommends for the TLC program and what kind of different aspects that she hears about that kind of are triggers for her.
Hello, can you guys hear me? Okay. So I am Hope Plaker. I'm another local girl too. I grew up in Washington and I've been practicing here in Peoria for about 7 years. And I'm currently participating and involved in the certification program through the Institute of Functional Medicine, because this has been an area that's personally and professionally I've had a strong interest in for a few years now. Early in my practice, I saw a big problem with what we were doing. But to go back to Leslie's question, who should enroll in TLC? And that's, in my opinion, one of the most fun aspects of my job is to act as an investigator, learning more about you, because I don't really think that there's a black and white answer to who should enroll in TLC. There's the obvious answer. There's the patient that I meet that comes in that has, their problem list, 15 existing diagnoses the first day that I meet them, with maybe 15 to 20 prescription medications. So that's the obvious patient who's already been diagnosed with problems and is maybe looking to either hopefully get off some of those prescription medications or be able to wash clean some of those diagnoses from their profile. Then there's maybe the not so obvious patient who I think could really benefit from this, and that's the patient who's hungry to learn more about their health, to learn more about what's going on a cellular level in their body, to learn if they have risk factors. So on the other end of the spectrum, there's the perfectly healthy patient who wants to know more. But I also look for patients, and this is where the detective work comes in, who maybe don't come out and tell me that they have a problem with anything. When I ask, well, what brings you in? What's going on? How are you? You know, we get the usual answers, but then they say, well, I have been kind of tired lately. I'm not sleeping very well either. And you know what, I'm bloated a lot too. And so there's a lot of different body systems that come into play that perhaps no one's diagnosed a problem with that, but underneath the surface, there's a lot brewing. And so the fire may not be fully burning, but we're adding a lot of logs to it every day. So I look for that patient as well. I don't think there's an age frame. I think the youngest patient I've had that's gone through the TLC program has been in her mid-20s. We don't want to wait for a compounding effect of maybe some negative aspects of our diet or our lifestyle or our environment. We want to, learn these tools, learn our body at any age, because health is important at all ages. So I also look at family history. I think that's something that can't be missed. You might feel well, you might not have any diagnoses or outright problems, but if mom and dad both had cancers, mom and dad maybe both had strokes or heart disease, that's important to take into account too, because of course, as Dr. Couri and Leslie both said, our genes are not our destiny, but they are very important when we're analyzing what potentially could happen in our health. Okay.
Okay, so let's get down to the nitty-gritty. What is TLC and what happens throughout the program? It starts with 17 weeks. We are going to create an individualized plan for you, just you, based off of your history, your labs, all that good stuff. And we're going to stop along the way at these different stops, each being a different stop that will get you to exactly where we want you to be in terms of optimal health. So we start off with a consult. You will meet with one of our great providers here, and that's when they're going to spend the time to get to understand you, get to understand your medical history. What signs and symptoms are you struggling with on a daily basis that you might think are normal, but really should not be happening in your body? They will discuss treatment options for what they think is a good idea for you, as well as set goals. What is the point of this program for you? Where do they want you to be by the end of that program? It's also a good time for you to develop a relationship with one of those providers, so that when you stop back and see them at the end and you're going over your results, they know you and you know them a little bit as well. Everybody take a deep breath. The word detox tends to show or throw people into a panic. We start right off the bang with something that's called a 7-day liver detox. Dr. Couri already hinted on it before, talking about how the liver and your detoxification system is so important for your body. What this 7-day detox is going to do is it is going to help restore healthy detoxification functions and make sure your GI system is functioning properly at the same time. I think I tell every one of my patients that I've done it many times, and that my husband has done it twice, and he is the biggest wimp in the world. So if he can do it, I promise you, you can all do it. It is very easy. It's 7 days. I promise you, eat throughout the entire thing. It is very much so cruciferous based, so it's got lots of good cruciferous vegetables in it, and truthfully, by the end of it, you feel like $1,000,000. You really do notice the difference from the beginning to the end. We go with what measurements? Yes.
It is not a colon cleanse. You're not living in the bathroom for 7 days. You can go to work.
You will not explode.
You won't explode. You're not putting your feet in water to see if it turns brown by how toxic you are. It's grounded in science. You're not going to live in the bathroom. Just wanted to put
Yes. From there, we're going to go with measurements. Again, weight is not the end-all be-all, but it's something that is certainly trackable. We are also going to do girth measurements because, believe it or not, especially with excess belly inflammation, the first place you're going to see it is in your measurements. And Dr. Couri talked about the bioimpedance analysis. This is a machine that we have that lets me analyze the pounds of fat you have, your body fat percentage, your fat-free mass, cellular mass, your basal metabolic rate, hydration levels, things like that. Again, it gives me a better idea what's going on cellularly in your body and not just how many pounds you've gone up or down. A nutrition plan is created, again, customized just for you. We do not follow any one particular diet plan. We don't do calorie counting. I ask every one of my patients, can anybody scientifically tell me what a calorie is? Then why are we counting them? Okay. It's easy tracking. It's based off of food groups, and we don't do shakes, we don't do bars, we don't do diet foods, powders, things like that. We eat food. You pull it out of the earth, you kill it. That's the food we eat. Your provider will make recommendations for your supplements based off of your lab results and your symptoms and the consultation time that you had with them. We use evidence-based nutraceutical grade supplements. These are not Walmart, Target, GNC, I'm trying to think of where else. These are supplements that are such a high grade that they have actually gone through FDA testing to make sure that what they say is in their products is in their products. There are no fillers. You don't have to worry about gluten or dairy or anything else being put into your supplements. And they are affordable. They're not going to cost you hundreds and hundreds of dollars every single month. This is new to the TLC program and kind of exciting. We now have a lifestyle portal. And so what this allows me to do is, I already get to harass you once a week. You're going to come in once a week. But this lets me harass you every day. So I will get to send you emails that are full of great and exciting motivation. You will get more information on the diet that you're on, as well as a full library of recipes and exercise videos. All my patients come in and we do a workout, and a lot of the times they leave and they're like, I don't have a clue what we just did. So this lets me be able to send you the workouts that we did so that you have a better idea of being able to refer back to what we did. It also is kind of a nice little Fitbit tool. I know lots of women who like to track things, whether it be on MyFitnessPal or Weight Watchers or all those cool tools. You can do it all on here, track your progress, good stuff like that. You do have 2 personal training sessions as well as some exercise education. It's nice because it does give you a better understanding of exercise. It's not just there to help you lose weight and be skinny. There are actually physiological reasons why we need exercise. So we make it a little bit easier for you to want to exercise because you understand the benefits that it's providing your body. Has anybody not heard about our sauna? Are there lots of people that haven't heard about our sauna? Okay. We have an infrared sauna. So most people understand saunas to be what you see at the gym. It's got lots of steam coming out of it, makes you sweat. Our sauna is a little bit different. It's based off of infrared wavelengths. So these wavelengths are going to actually penetrate your skin and heat you from the inside out. So instead of just making you hot, it's actually going to detoxify your body. It is going to help you lose weight because it's going to increase your metabolism. It's going to help your skin and all of the elasticity in your skin and many, many other benefits. So we're going to throw you in the sauna for a couple times so that you can use that up to your benefit. And then we actually have 5 different steps for stress. We are going to work on your sleep habits. We are going to work on stress reduction through deep breathing. You're going to do the biofeedback program. You're going to have a massage. And we also have yoga at the Couri Center once a month. Something else that your provider will go over with you throughout the program is everybody gets tested for hormones. So you'll be able to decide, whether that is something that works best for you, whether you are suffering from the symptoms, do you need it? That's the big question, is that you might be wondering, do I need it, do I not? You'll be able to get that information. And then, again, these are some of the benefits for men and women. Okay. So let's add it all up. Everybody take a deep breath. This is going to be a really big number. So if you were going to say, hey, I want to come to your office and this is everything I want to do, all the labs, all the visits, all that good stuff, it's about $5,200. So we obviously don't want to do that to anybody. That's just cruel. So the cost of the program, your visits with your providers and all of your labs are billed to your insurance. So that is a nice little benefit. Supplements, it depends on the program you're on. You're looking at probably between $25, $75, maybe a little bit more per month, depending on what your labs are looking at. And the cost of the program is one of 3 options. You've got $790, 3 installments of $275, or $50 a week, whatever works best for your budget. They all kind of run into each other. And as I say this, I know that being, a working individual, it's kind of terrifying to see $790 and figure out how am I going to make this work. That's why I really prefer people to look at the $50 a week. Look at what you can give up. Your trips to Starbucks, your Polar Pops that come from the gas station once, maybe twice a day. That really great green tea that you think is any different than any other green tea you get at Starbucks. You know, we all have these things that we just keep swiping our debit card for, and it all adds up. And $50 a week is doable. $50 a week is something that you can do to invest in your health to make sure 5, 10, 15, 20 years down the road, you know, you're not on 15 medications and trying to figure out how on this fixed budget am I going to pay for these things. So now that you've kind of learned about the program, I think it's nice to really analyze and think, how can it change your life? What in the back of your head do you know you already need to fix? So this is maybe one of my favorite patients.
The TLC program has changed my life in many ways. I have a lot more energy. I feel good every day, and I am pain-free. I used to have a headache every day, well, probably 5 days a week. I have not had a headache since I started the program. This journey has surprised me by how easy it is. It's not about weight loss, it's about disease prevention. And by eating healthy and exercising. So it's a lifestyle change, not just a diet. The pre-TLC me and the post are two very different people. The pre, I didn't do a whole lot, and I found myself dragging around all day long, which is not a lot of fun. And probably the post-TLC me, I look totally different, I've been told, but I feel so much better. And it is not about the weight loss, it's about how you feel. And for me, it's about the disease prevention. Healthy to me means that I watch what I eat every day, but I'm okay with that. It also means doing more activities with my husband and my family, not yawning all day long like I used to. I do not worry about my health now. I feel amazing. I had to bring down some levels, blood work levels, and I've been able to do that in the 3.5 months that I did the program. So I feel very good. I will continue checking my levels, you know, just as regular checkups, but no, I don't worry about it. My outlook on life now is that I am going to have a whole lot of fun in my mid-age. We're going to have a grandchild in March, so I want to be able to get on the floor and play with that child and go on bike rides and do all sorts of activities. So I am really looking forward to the next part of my life. The staff in office are amazing, a very big support system. The staff, especially Leslie, is amazing. I know it takes the whole team to make this program work, and everyone is good at what they're doing, but Leslie, I have to say, really makes the program. The office staff, every day that you come in, they're very supportive, very helpful, can answer any questions that you have. I would recommend it, which I've already been doing to people, that this is one of the easiest transitions I've ever done with lifestyle change, because it is not a diet, it is a lifestyle change. And my husband and children have converted a little bit, but so have my distant family as well. I talk to everybody that I come in contact with that asks me what I've done. So I do recommend to them to contact Dr. Couri's office.
Questions?
Questions for any of us about anything? It doesn't have to be the TLC program.
So, you said weekly visit, it's once a week during those 17 weeks, so what do those visits consist of?
It is once a week throughout the program. Each one of those weeks we do one of the topics that I discussed. We start off with the detox, that's 1 week. We transition into regular, nutrition, that's another week. We do supplement recommendations and explanations, that's another week. so that you kind of just progress throughout the entire program, building upon each level.
And I want to point out too, it's an individual visit. You're not coming through with maybe 5 people tonight who decide to sign up for the TLC. It's always one-on-one. And most of our patients are employed full-time or part-time or have a family that they're caring for. So visits don't necessarily have to be every single week back-to-back. Life happens and your schedule changes, so we really build it around your availability to whenever you can come in.
What's the typical duration of the appointment? Is it a half hour or is it?
Usually about a half an hour. Yeah, it doesn't usually go any longer than 45 minutes. And there are early morning times. Earliest morning is about 7 o'clock.
And when you say there's 2 provider visits, is that with the MD?
Yeah, so depending on who you start with, if you're already my patient, then those provider visits are with me. If you're not my patient, let's say it's Hope's patient, then those provider visits are with Hope. If you're totally new to the practice, then you can specify who you want to see for those to get started into the program. So you can see me, you can see Sue, Lynn, you can see Hope. So it just depends on who you are already aligned with, and if you're not aligned with any of us, then you can request when you make the appointment.
And you have good luck getting all that covered with the insurers?
The
I thought before you
the
said the
lab
labs
work-
were more
lab work.
expensive.
The lab work gets covered. And what doesn't get covered, like food sensitivities is not covered, but we put that cost into the cost of the program, so it's not an extra fee.
Oh, I see.
So whatever lab work is not covered is absorbed into the cost of the program. Supplements aren't covered. The program itself is not covered by insurance, although you can use flex spending money towards it. But maybe in not too far off time, insurance will cover prevention, which would be nice. And, yeah.
Do you provide a TLC service for male?
Oh, good point. Yeah. So we've started seeing male patients for wellness, so TLC program, and also for male hormone replacement, for testosterone replacement.
So if the insurance covers that, does that 7, whatever the total, go down, or no? That's
If
the,
it covers,
like your labs and your office visits, or is that all like inclusive? If the insurance covers it, is it still the?
it is because the cost of those labs
Mm-hmm.
is, what it was,
Up 1,300 times 2.
yeah, so.
That 790 encompasses everything else that you would get with the program. So
Okay.
we pulled out the part that can be applicable to insurance, and the rest of it is everything else thrown into it. The only thing out of pocket that you would pay outside that cost would be for the supplements that were recommended to you. Otherwise, everything is included in that cost.
What's the latest appointment you guys take?
Good question. The latest appointments are around 4. What's your latest? 4? 4. And if there's any other ideas for classes, make sure you get them to me, because this is why we do them. We do them for you guys. It's fun for us, but we want to make sure that you're getting something out of it. So, thank you.
Thank you.
Thank you very much.